we are going to start from the beginning, that is from conception. That is when the mother is during the first trimester. We normally do have antenatal care, which involves taking care of the mother wholesomely, including giving supplements, looking for any danger signs during the pregnancy period, advising the mother accordingly on the minor and the major complications of pregnancy. So for us, because we are focusing on anencephaly, from antenatal care, what we do preventive management of anencephaly, which includes giving folic acid. Folic acid during the early periods of pregnancy, it enables the mother in development of the neurotube. And as you know, anencephaly is undeveloped or underdeveloped neurotube, whereby it doesn't close, and therefore you get the brain or some parts of the fault have not formed. So majorly during the NC visit, we insist of folic acid, which should be taken up to the 3rd trimester. And then during these follow-up visits, there is what we call a fundal examination of the mother. During the fundal examination of the mother, as the pregnancy develops, during palpation, you need to feel the fetal head. So normally by 20 weeks, from 16 to 20 weeks, the fetal head should feel like a ball that is round. So if it doesn't feel, then that should raise suspicion. So the mother should be sent for ultrasound as a confirmation or a diagnostic step for anencephaly. So upon receiving the results from the ultrasound, the doctor should look at the results, and if the results are confirmatory that there is a congenital defect on the baby, and if a diagnosis of anencephaly is made, then the mother is taken for counseling. Counseling, which involves, number one, either termination of the fetus, or if the fetus is above 20 weeks, then the mother can be advised on keeping the pregnancy, but bearing in mind that upon delivery, the child cannot be able to survive due to congenital malformations of the brain. So the mother first is taken for counseling. In fact, both the parents, they are taken for counseling, and then they should accept and they give way forward. Normally they are advised on what is supposed to be done, but they are also given an opportunity to say what they want to be done. So if they consent to termination of the fetus before 20 weeks, then medically the mother will be admitted, and an abortion will be carried on that mother. But if the pregnancy is above 20 weeks, then the mother is counseled on what to expect on the delivery, and frequent follow-up visits are made so that the mother does not go to stress, because that is a very stressful situation when you are carrying the pregnancy and then you are told that the fetus is unlikely to be viable. So during the delivery, it's normally advised that both the parents are there, and then if it's a vaginal delivery is done, normally the baby there's a receiving nurse, or the midwife is conducting the delivery, will take the baby, then they conduct the delivery well. Then upon finishing the delivery, now the mother should be shown the baby. So normally the appearance of the baby itself is trauma to the parents, so they may be shown the baby, and depending on the severity, because there are some whom you find that the brain tissue which has not formed is not much, so they are a bit normal, and there are some whom you find both much of the brain did not form, so they have a frog-like appearance. So depending on the severity of the baby, now the parents are shown, and then from the beginning this baby will have issues with the respiration, with the breathing, with movement, everything, because it's the brain that controls the whole of the body. The nervous system is involved, from the brain to the spinal cord to all movements of the body. So you will find that this baby from the beginning, from the start, will have issues. Normally as nurses, we'll try to sustain the baby as much as we can, maybe by inserting an NG tube, putting the baby on oxygen, but the prognosis is never good. Normally these babies can survive for a maximum or at most 2 weeks. That is on support care under a professional. So these parents, normally they can be allowed to hold their baby. For those who don't want, the fetus, the baby now is taken, but is cared for until they die. So normally when they pack, that is when they die, there's normally the hospital protocol. In most hospitals, if the baby is severely malformed and the parents are not willing to take the body, then the hospital disposes. But being in an African setting and being Africans, most parents could want to take their body home and go and bury. So normally what they do, what the hospital does, it gives them a birth notification. On that birth notification, the notification goes home and will act as a burial permit. Then they are allowed to take the body and bury it depending on their culture or whatever they want. That is normally after they have undergone counseling on the grieving period, because most often you get that these pregnancies, they are much anticipated, they are much waited for. So when they get those disappointments, you may get those parents going into stress. So normally the nurse, there's a counselor who takes them through the grieving period until they accept, until they go and bury the body.